Hi everyone. Welcome to our live streaming series on Mandela Singapore and Malaysia Facebook pages. So I'm your host Shameen. So it's a afternoon session this week. So we'll just let everyone come in and join in the session for a while. So while we're waiting, just remember that our live shows are streamed on our Facebook page weekly. So do like and follow us on Mandela Singapore and Mandela Malaysia Facebook pages to get updates on when the sessions are and what the topics are and who's going to speak. So on that, like for the next two sessions, it's going to be by Datin Dr. Karen Fung. She's a dentist. She's going to be speaking about how breastfeeding can affect baby's facial muscle. So that will be next Saturday on August the 15th at 8:30 p.m. And the week after, it's again by Dr. Karen Fung on how to take care of baby's oral hygiene for breastfeeding babies. So that will be on August 22nd at 8:30 p.m. So do like and share now to stand a chance to win this. This is our mystery prize for this week. The Safe and Dry Ultra Team Disposable Nursing Pads by Medela. So it's a 30 pieces pack. So do like and share. The first, we'll be choosing 3 winners to win this, and we'll get in touch with you. We'll let you know who the winners are at the end of this session, so do stay tuned. So there's also a Medela trial, breast pump trial program at the PG Service Center in KL. So pregnant mummies, you'll be able to feel and look how the freestyle and freestyle flex are before you actually do decide to purchase. But currently, moms who are breastfeeding, you'll be able to actually test it out. So you know for sure that this is what you like and what you want to get. So do make an appointment with us through our Facebook, DM, WhatsApp, or email, as there are 2 appointment slots only per day. So do make an appointment with us. It's in the KL Service Center. And today we are welcoming back Miss Alpany. So Miss Alpany, she presented to us previously about how to start breastfeeding. Today she's going to be talking about myths and facts about breastfeeding. So if you have any questions, do leave your questions in the comments and we'll get Alpany to answer them. So it's more of like a conversation today and question and answers. So do feel free to just leave your questions of anything about breastfeeding that you can think of. Even do not think that it's dumb, because any questions are valid and valuable. So for those of you who did not join us previously, I'll give a little introduction about Miss Alpany. So Miss Alpany Binti Ramli was trained at KPJ International College of Nursing in 2010. She has special interest in breastfeeding and now works as a lactation educator in one of the prestigious private hospital in KL since 2015. She's been conducting parent-craft programs for parents and also conducting breastfeeding trainings for the hospital staff. Her experience with breastfeeding her 2 daughters always helped her with managing and handling her patients who come to her about breastfeeding advice. She is also actively involved with breastfeeding events and programs in the community. So I would like to welcome Alpany on screen.
Hi, Shamin. Good afternoon.
Hi, Alpany. Welcome back.
Yes, thank you so much for having me today again
Yes,
to share
it's good.
more knowledge to all mother
Mhm.
out there. Okay, especially regarding breastfeeding. And
Yes.
basically, actually, this week is World Breastfeeding Week.
Mm-hmm.
So I'm so happy that I can involve with Medela to share more with mother out there on the benefit of breastfeeding. So what breastfeeding mother can do. So and how they can breastfeed their babies well with a
Yes.
good support and a good knowledge is very important.
Okay. So it's World Breastfeeding Week, so it's a world celebration. So we're trying to like make breastfeeding normal, how and to just help mothers around the world as well to be able to have more knowledge about how breastfeeding helps their babies from the very hour that they are born. Yeah.
Yes.
So
Wow.
that's
So
yeah.
Shimi learned a lot of things from the first session as well.
Yes.
What we
I
discussed,
definitely
right?
did.
Before.
Yeah.
Mm.
Okay. So we do have the questions that that some myths that we would like some answers to. So probably we'll just start with a few of the myths.
Yes. Okay,
Yes.
sure.
So number one, if a mother is ill with a cold or the flu, should she still quit breastfeeding?
Okay. So it's very common, right? Okay, as a lactation educator in the hospital, and just to introduce a little bit more about myself. Okay, I'm a trained peer counselor since 2014, and I became a lactation counselor in 2016, and now I'm working as a lactation educator since 2015. So I did encounter a lot of mother who come to me during the pregnancy, even after the delivery. I will handle them to just assist them with breastfeeding, and even when they go back home, okay, if they do need help, they also come back and see me. So it's very common, okay, especially okay before we go further with all the myth and fact, okay,
Mm.
just let explain a little bit about the topic that we will discuss more today. So it's
Mm-hmm.
very common as a new parents, especially as a mother, even it was your second or third baby and you just want to start breastfeeding, there's a lot of people will start come and share to you a lot of fact, a lot of
Mm.
information. All right, regarding breastfeeding. Is it true, Shamin?
Yes.
You're also a breastfeeding mother, right?
Yes.
Yeah, sometimes their intention is very good. Actually, they just want to help you by giving those advice, okay, to make sure that you are breastfeeding your babies well. But
Mm.
initially, most of the a lot of fact or a lot of information that given to the mother is just based on the experience before. It's not according to the fact. So it was so important to all the mother out there, okay, to make sure that you get a correct fact so that you can happily breastfeed your baby. Okay, so we are going back to the question that Shamin asked me just now. Okay, if a mother is ill with cold or the flu,
Mm.
did she need to quit breastfeeding or not? So, okay, I'm a breastfeeding mother for two kids. Okay, my first girl, Alhamdulillah, I able to fully breastfeed her for 2.5 years, and I just
Wow.
my second girl last May. Okay, 2.5 years as well. Okay, so and I'm a breastfeeding mother. I'm not mutant. I'm
Mm-hmm.
not mutant. Throughout the 2.5 years, I do fall sick. Okay,
Mm.
I'm having fever, I'm having diarrhea, I'm having flu, having cough, but I never stop breastfeeding because I
Mm.
know that when we fall sick, okay, our body will produce antibody. And the good thing about breast milk is it will transfer the antibody that you produce to protect yourself, and you will produce the antibody and transfer to the baby at the same time when you are sick. So it was so good. Okay, our milk is very unique. When you fall sick, you produce antibody and the antibody will transfer to your baby. But you need to take precaution. If you are flu and you are sneezing, don't flu straight to your baby. Don't you nose and you touch your baby. You just need to take extra precaution. You wash your hand, okay? You don't cough on your baby, and you can still continue feeding your baby. And even there's a lot of medicine out there that is safe for breastfeeding mother because some mother they thought that when they are feeding their baby, they cannot take any medication, any medicine, which is not true as well. Okay,
Mm.
there's a lot of medicine out there. It's safe for a breastfeeding mother. The only thing is you need to be aware is whenever you go for your doctor's visit or you do your checkup when you fall sick, you just need to tell the doctor that, okay, doctor, I'm a breastfeeding mother. Please
Mm.
prescribe to me something that is safe for breastfeeding. Okay, when you are pregnant, you go and see doctor. Doctor will make sure that they give something that's safe for you, right?
Mhm.
Without you need to tell them that you are pregnant because you can obviously see your tummy. But when you are breastfeeding, doctor cannot you cannot assume that doctor will know that you are breastfeeding. So
Yeah.
you need to tell them that I'm a breastfeeding mother and I'm having flu and cough. Please give something that's safe for me so that I can continue breastfeed my baby. So actually no need for you to stop breastfeeding is just because you're having flu or cold. Okay, there's a lot of mother who breastfeed their baby so long, but yet they still continue breastfeed. Like I mentioned before, okay, we are not mutant. We will fall sick. Okay, so
Mm.
the statement is not correct. It's a mix actually.
Okay. So
Can you hear me?
following on to that that statement, personally also I mean I'm not sure. That's why I want to ask whether it's true or not. Like because of the medication that we take, because sometimes like mothers they say, oh no, I don't want to take the medicine because I'm afraid the baby will be ingesting it from the breast milk. Is
Mm-hmm.
that how true or how false is that? Yeah.
Yeah, okay. That's the reason I did mention to you before. Whenever you fall sick and seek for doctor advice, you need to tell the doctor that you do breastfeed the baby because there is a risk of some medication that
Mm.
they will pass through a breast milk.
Mm.
And the medication that's safe for breastfeeding, it will also pass through the milk, but very macro. Very micro unit of that medication will pass through the milk and will pass to the baby, and it was safe actually for the baby to consume, even you are taking the medication. So
Mm.
you just need to ask. That's the most important thing. Okay, don't just try to be a superwoman because you are a breastfeeding mother, you think that okay, I no need to take anything because I'm a breastfeeding mother, so I cannot take any medication. So don't suffer. Okay, there's a lot of things out there that help you as well.
Mm.
Okay,
Okay.
Shani, you also
Mm.
having a baby, right? So how old is your baby?
So she's 6 months already.
All right. So did you do for having cough or flu throughout the 6 months?
I had mastitis, so that was quite bad. Yeah,
All right.
it was a fever, everything. So I went to the doctor, gave antibiotics. So I did ask the doctor that
Mm-hmm.
if you had anything for that's safe for breastfeeding.
Mm-hmm.
So yeah, because to me, I even when I before I got pregnant and everything, when I was sick, I usually just don't do anything, don't take
Mm-hmm.
anything. Yeah, so just naturally because I didn't want my body to get used to antibiotics.
Mm-hmm.
Yeah, so but then with the mastitis, you don't really have a choice, right? You have to get the
Yes.
infection sorted. If not, it'll just be worse for your breastfeeding journey, and you won't be able to feed your baby as well. Yeah.
Yes. Okay. So you just to just make it clear, okay, even a
Mm.
newborn, a baby, they also been prescribed antibiotic if they need it during their baby time. So if the antibiotic is safe for the newborn, it also safe for us to consume. It's just
Mm.
okay. All
Mm.
right. Okay. So
Okay.
I clear out this point. Okay. Even you are falling sick, okay, you can just still continue feeding the baby, but you need to take extra precaution. Okay, so that you
So
don't.
so even with mastitis, like because
Mhm.
I mean, on one hand, the doctor told me not to feed on the side with mastitis, but then on
Mhm.
another hand, a lot of lactation consultants they do advise you to let the baby suck on the side with mastitis to help release. So why is this one saying that and one saying that?
All right. Okay. So mastitis basically is two things happen. Mastitis is just the breast swollen, or mastitis infected mastitis with abscess. Okay, if you
Mm,
can clearly see there's a pus come out from the breast because of the mastitis, we will advise mother not to feed on that breast with a pus. Okay, but when you express your milk from the breast and the milk doesn't got pus, you can continue feed your baby on that breast. So while the pus is still there, we will advise mother just to express the milk out. Okay, you cannot ignore
mm,
the breast because of the pus. Okay, you still need to express it out so that you empty the breast. You still give a signal to the breast that you still need that the production there. But if the milk mixed with pus, you need to stop feeding the baby. So we don't want to feed our baby with pus because it's contained bacteria. Maybe this is why your doctor advised you to stop. Okay, if there's an abscess, we cannot feed the baby there. If there's a pus there, we cannot feed. Okay, but if it's only mastitis without the infection, you can still continue feed the baby on that breast.
Okay. All right. Good to know. I hope it doesn't happen
Okay.
again. Though. That's
Yeah. Okay.
painful. That's
Your
painful.
baby is just really look like a machine. I don't think so that you will have that issue already.
Okay.
Okay.
The second myth: small-breasted women cannot produce enough milk. That
Yes,
would
it's
be
very
my
common,
question
right?
also.
Yeah. I did get this point of view, especially from my Chinese patient. Okay, those days, okay, not so many Chinese mother are feeding their baby because of this
Mm.
perception. They might thought that, oh, Malay can feed well, Indian can feed well, okay, Caucasian can feed better because they have bigger breasts. Actually, what happened is, okay, I always compare, all right, breast and other part of our body. Okay, I have a bigger nose, you have a smaller nose, but we can smell the same durian. Okay, some have a bigger eyes and some will have a smaller ears. Okay, but we can
Mhm.
hear on the same thing. Okay, same thing goes to the breast. Bigger breast size doesn't matter actually. All right, the size of the breast is affected by how much fat tissue that the mother have in their breast. Okay, if they have more fat, then we have more a bigger breast. If they have less fat, they will have less. The size is smaller. But actually, roughly all women have a same amount of milk gland in their breast. That is the
Mm.
most important thing. The milk gland, the factory. Okay, most of the women they start having their milk gland even since puberty. Okay, and it will growing according to the baby, according to the woman's age, and when they go through pregnancy, okay, the hormone there will have to enlarge the gland and multiple all the fat tissue there. Okay, and the size is doesn't matter. Okay, I have
Mm.
friends who are only 30 kilo plus. If you look at her, she just look like a standard six girl, and she fully breastfed her two kids, and she have plenty of milk.
Wow.
Okay. All right. So it doesn't matter how big or how small, as long as you understand the concept of demand and supply. Okay. You don't have any issue with your milk gland, with your pituitary gland on the brain. You skip feeding the baby. You meet the demand and supply, and you will produce enough milk for your baby. The size is doesn't matter. So don't feel uh, afraid about the size of the breast. Okay, it
Mm.
it will produce the same milk.
Okay. All right. Yeah, choose no Shahida. Choose size doesn't matter. I'm breastfeeding my baby now. She's 9 months. I'm a first time mommy, by the way. Well
Wow,
done. Well done.
congratulations, Shuhaida. Okay, it's not an easy job, right? Especially to feed your first baby. All right. But you are doing very well. It's 9 months. Okay, you already get your diploma in breastfeeding. So go for your degree in breastfeeding for 1 year. I already have a double PhD.
I'm still doing my
Oh,
diploma.
yeah, just leave your diploma is fine. Okay, now I just went off my baby. Okay, woman, we are so funny. Okay, when you are feeding your baby, you might feel I'm so tired. Okay, I'm so okay. When the journey will end, but once you win off your baby, you might miss the moment. Like I just
Mm.
at my girl when she's still sleeping, and I told myself, oh my god, I already missed the breastfeeding
Oh,
moment. Okay, so I told my
yeah.
husband, and my husband tell me that okay, let's make another baby. And no, you just tell that oh, making a baby just like a factory and the baby. Okay, so
Okay.
Shibi, small
Mm.
breast doesn't mean that mother will have less milk. Okay, uh,
Okay.
size doesn't matter in breastfeeding. Hmm.
Okay. Good to know. All right. The third myth: mothers need to drink milk to make milk.
Okay, it's very common, right? Some mother they thought okay, because they do not understand how milk produce. Okay, they might thought that okay, the milk that I drink and it will become milk. Okay, it's not necessary to drink milk. Okay, how for those mother who allergic to milk, and how for those
Mm.
mother who don't ever drink milk? Okay, they only drink milk when they are still baby, and after that they don't drink milk. Them, right? Okay, so it's not necessary for you to come compulsory buy a special milk so that you have more milk. Okay.
Mm.
For those who doesn't have money to buy milk, don't think that, "Oh, I don't drink milk, so I will not produce milk." No, all right. Okay, what you need to do is you just need to make sure that you have a healthy food to eat. Okay, and you drink enough. Okay, enough liquids means that whenever you feel thirsty, you drink water or any kind of liquids. How you know that you have enough liquid in your body? Okay, always check back your urine color. Okay, or always check back your urine color. Okay, from your urine color, you will know either you have enough water or not in your body. I
Mm.
always because some other are asking me how I supposed to know that I have enough liquid in our body, and I always tell them to just check back their urine color so that they will know either they have enough water in their body or not. Okay, so no need to drink milk so that don't have this perception drink milk only that you have milk. No, okay.
Okay. But then, okay, so on top of that, because when I take the supplements, the multivitamins, my urine is a bit more yellow. It's more yellow as well. So it's what they say is the extra riboflavin coming out from the yeah.
Sorry.
So yeah, as I was saying, I because when I take my multivitamin supplements,
Mm-hmm.
my urine gets a bit more yellow because of the
Mm-hmm.
extra riboflavin coming out. So
Yes.
it's a bit, and I noticed that it also my breast milk becomes more yellow as well.
Mm-hmm.
So is that normal and okay for the baby to be drinking? I mean, I've been giving it to her, so
So if the medication that you take that is safe for you to consume during breastfeeding is supposed to be safe.
mm, so okay,
Mm.
all right. I'm a first time mom too and fully breastfeed my 6 month old. I had a bad clot the other day and during a lecture. It feels like knife
Mm-hmm.
cutting. Oh, pain was killing me. Oh dear.
Yes,
Oh
first time
dear.
mom. Mm-hmm.
Yeah, guess.
So did she able to? I hope that she able to encounter the problem. And if she still do have that problem, maybe she can just look for any counselor that available to check on her.
Yeah. Maybe it's the latch. Maybe it's, yeah,
Yes.
something, right?
Mm-hmm.
Okay, well, go to the next myth. Breastfeed baby needs water in the early days and when it is hot. No. hmm. Breastfed baby needs water in the early days and when it is hot. I say no.
Okay. Hold on, hold on,
Yeah.
Shabir.
Okay, maybe I'll speak a little bit about this. I think in our parents' time, a lot of them will be like, "Oh, the baby has a hiccup. Give them water." But I think what
Okay,
they've not,
hold on, Shabir.
yeah. So I think what they've not realized that water can be a bit toxic for the babies, and breast milk is full of water already. So that breast milk is more than enough for the baby. So I kind of, even my parent, like my mom herself, when my baby started hiccuping, she was like, "Oh, she needs to drink some water." I was like, "No." I mean, yeah. So this one we'll get Alpany to let us know whether it is in fact a myth or a fact.
All right, okay. So it's very common, right? We get an advice, especially from all parents, that
Mm,
we need to give water to the baby.
especially when
Yeah.
they're hiccuping.
Yes. Okay. So what you do, Shamin, is very good. Okay. So water is not safe for a newborn baby.
Mm,
Okay, and 88% of actually breast milk contain water. So we no need to top up extra water to the baby actually.
Mm. Okay. So, but they can start having some water when they start solids, right?
Yes, okay, when you start giving food to the baby, that is the time for you to give water to the baby actually.
Mm.
Mm.
Okay. Good to know. All right. For the next.
Yes, yeah, that's true, no, Shuhaida. It's very difficult to tell all people that baby doesn't need water because those days they don't have all this information. Okay,
Well,
because
yeah.
because they are commonly give water to the baby, but actually,
And I was
yeah,
given water as well, apparently.
yes,
So I
okay, and what
so
they will
yeah.
tell you, yeah, what they will tell you is okay, because you drink water, it's supposed to be safe to your baby to drink water as well. Okay,
I
but what will happen is we don't know actually how much water is safe for the baby. So
mm,
not to give water to the baby is the best until the baby is 6 months old and you start give food to the baby. So
mm,
even the weather is hot, our breast milk is very unique. When the weather is very hot, okay,
give
it
you
will
more
be
water.
more diluted to
Mm.
yes to squeeze your baby third.
Ah, no
Yes. At night
wonder.
you can yes, and at night you can see that our milk is more fat. There's more
Yeah.
fat in our milk because the weather is cold.
Oh wow, that's something
Yes. Okay.
new.
So if you express your milk in maybe Japan, Korea with a snow there,
It
when
will
it's
always
in
be
daytime
fatty.
and you express, you might see that the milk is contain more fat compared to water. It depends on the weather. That is how unique our breast milk is.
Wow. Okay. No
Mm.
wonder I was thinking like, how come during the day like my breast milk seems a bit more diluted than the night expression?
Yeah. Yes.
Ah, didn't
Why?
think. I never
So
thought about that.
that's your breast milk.
Huh?
So the baby doesn't need extra. They did do research on this before they come out with the statement.
Okay. All right. So moving on to the next one. Nipples should be cleaned with soap and water before every feeding. Hmm.
Yes. Did you do that, Shamin?
No. Because I was told that breast milk itself it's the best
Mm-hmm.
to clean your
Mm-hmm.
nipple. So
Mm-hmm.
I don't do it.
All right. Okay. So every woman when they are pregnant, okay, they might notice on the nipple there's a small dot will appear, and the small dot we call that as a Montgomery gland. Okay, and the gland is the function of this gland. Okay, is to moist the area of the breast to
Mm.
clean it naturally. Okay, so that mother no need to use soap or need to clean their breast before they feed the baby.
Hmm. Interesting. Yeah. And I think it's like too much. What if breast milk mixed with formula? Hmm.
Hmm.
Do
Right?
you, Tiffany? Do you mean the breast milk you mix with the formula in the bottle?
Sorry.
The Tiffany has what if breast milk mixed with formula? Is that
All right. Okay. So it's very common question again. Okay. How if mother want to mix their breast milk and formula? Okay. So basically, what happen is when you drink breast milk, breast milk contain antibody. Okay. When the baby drink the milk, okay, when your baby drink the milk, it will coat the baby digestive system with all the protection. Okay, you just
mm,
imagine you paint the wall with all
mm,
the protection, and then when you give formula to the baby, okay, you will just flush away the well protected digestive system. The system is not well protected again. And another thing with mixing your milk with formula is, okay, when you start mixing your milk with formula, okay, so when the baby drink formula milk, the baby will drink less from your breast.
mm,
True, yeah, because it's already full with the baby is already full with the formula milk. So when the baby
mm.
drinks less from the breast, what will happen? Less stimulation on the breast and less milk production later. So that's the reason why some mother, after 1 or 2 months, the milk will getting lesser. But there's
Mm.
a mother can breastfeed their baby up to 2 years, 3 years, because they keep supply their milk to the baby. So if you understand about the demand and supply, and if you wish to breastfeed your baby more, you might understand why we don't really encourage mother to mix the milk with the formula. First thing is because the protection. Okay. Second thing is because of the demand and supply.
Mm. Okay. So the next myth: if a mother quits nursing, then changes her mind, can she not go back?
Yes. Okay. What do you think, Shamin? Before I discuss further with this.
I think you can.
You okay? Very good.
Yeah, because
Yeah.
you still. I think it's still a two-way communication with the breast and the baby.
Yes.
I That's how I think. So.
Yes. That's true. Okay.
Yeah.
So basically, even the mother stop nursing a baby, maybe because of the baby condition, maybe because of the baby is sick, they need to separate with the baby. Okay,
Mm.
maybe because they do have problem at the early part of their journey, and then because maybe most of the time it's because of the pain, they don't really get a good help, and then they just quit breastfeeding. And maybe after a few months, when they look at their friends feeding their baby, they feel that, oh, I think I want to try again. So it's still possible. We call this as a relactation. You heard about relactation before?
No.
Okay, relactation is the process of mother to produce milk again.
Mm.
Okay, there
How long would it take though?
it depend on the mother how disciplined is the mother is with the with the program that they will need to follow. Okay, what the
Mhm.
mother need to do is, okay, because there is some medication that will prescribe to the mother. Okay,
Don't
but
worry about.
mother cannot just buy a medication over the counter. Okay,
Mm.
means that they cannot just read throughout the internet and know what medication that need to take, and then they just buy and eat the medication. Okay, they
Mm.
cannot do that. Okay, because they need to have some checkup, medical checkup by a doctor,
Mm.
okay, to make sure either the medication is safe or not for them. There's some pumping schedule that they need to follow for
Mm.
them to produce milk. Okay, we call this process as a relactation process. And you just imagine, Shamin, I did help a mother who are taking adopted baby to produce milk, and
Oh
those
wow.
mothers not even pregnant.
Yeah. Is
They
that
are not
possible?
even pregnant, but they can still produce milk.
Oh
What
wow.
happen is, yeah, we just give with some guideline, okay, with some guidance by a lactation counselor, a lactation consultant, or a doctor who understand breastfeeding. They can help mother even to produce milk. So you just imagine a mother who just pregnant, who deliver a
Mm.
baby, the hormone is already there, the memory of milk is still inside the breast, and they can absolutely produce milk. Okay,
Wow.
but they need to be disciplined. They
Mm.
cannot hope for magic. It won't like you you take the medication today and tomorrow you will have milk. Okay, the process will take some times, and it's not impossible. So
Mm.
when they quit nursing, if they change their mind, they can still produce milk for their baby.
Wow. I'm
Mm.
surprised about the one that adoptive mothers are able to
Yeah.
actually produce milk as well.
Yes.
So it's just a power woman thing.
Yeah. Before this, I just heard about this, right? I just heard about adopted mother can breastfeed their baby. But when I already helped few mother with we call that as an induced lactation. Those
Mm.
who are getting adopted baby and feed their baby, I, I I'm I myself feel so amazed on how our body uh, can react and produce milk to the
Mm.
baby. It's so wonderful.
Wow. Okay. Good. Wow. I'm very, very amazed
Mm.
about that. Okay. The next one would be, if a mother picks up her baby every time he or she cries, she will spoil the baby.
So we already have the answer. The answer is no. All right. And I just shared one of my experience. I did attend a conference last 2 years by a nutritionist. Okay, she's a doctor, and there's one university in overseas. They did a research on breastfeeding baby and a not breastfeeding baby when they are 30th, when they are already 30th. Okay, when they are age 30th, they gather all the 30th. It's not kids already, adult,
Mm.
and some research on them, and they find out a breastfeeding baby when they are breastfeeding and when they grow up as a adult, they become so independent. They are a person that are very independent, very calm, very optimistic. All right, why this happened? Because for the first 2 years of their life, or even when they are still kids, okay, whenever they need someone, their mother are there, because breastfeeding is not only complete the baby physical needs, we
Mm.
also complete the emotional needs. Okay, there's the eye contact, okay, there's the skin to skin, and actually your baby feel more safe and more secure, okay, whenever you
Mm.
carry them, or whenever you feed them when they need it, when
Mm.
they need the feeding. Okay, so don't feel bad if you carry your crying baby and you feed them. Okay, trust me, you will miss the moment. Maybe on that time you might feel, oh my god, I'm so tired. She's crying again. But yeah, you will miss the moment. Trust me.
Mm. Yes, for sure. Okay, so the next one will be all babies will wake up to nurse when hungry enough.
Okay, so this one is for later, not for a newborn baby.
Mm.
Why? A newborn baby, they tend to thought that they are still in the tummy and they don't need to drink. They thought that, oh, the mother will still give all the nutrition that he need. Okay, and they assume that no need to drink. Okay, mother will give all the food. And a baby with jaundice,
Mm.
they
You're sleep.
tend to sleep
Yeah.
longer. So you need to make sure, especially for a newborn baby, for the first 1 week, you cannot wait for the crying baby, only then you feed your baby. Okay, you need to make sure that you feed your baby at least 2 to 3 hours. After 3 hours, if the baby is still sleeping, you need to wake up the baby to drink.
Yep.
Okay,
That's
so
true.
to feed your baby when the baby is hungry is not a good practice, especially when you have a newborn baby.
But after how many months?
Okay, depending on the baby. Some baby they will sleep throughout the night after 3 months, after a few months. So how about your baby, Shamin?
Actually, she did sleep through the night quite early. I think, yeah, about 2, 3 months.
All right. So did you still
But
wake up to
it wasn't
express
it wasn't
that?
a continuous like sleep through the night. Sometimes she'll still wake up, sometimes not.
Yeah.
So
So
yeah,
actually,
but I
it's
will still
depend.
express. Yeah.
Yeah, it's individual actually. If your
Mm.
baby sleep throughout the night after 1 or 2 months, and the weight gain is good, there's no issue. Okay, means that the baby have a very good weight gain, even she's sleeping throughout the night, so it's
Mm.
fine. But to
Mm.
make sure that you able to maintain your supply longer, when the baby is sleeping and you try to wake up, the baby don't want to wake up, you need to express your milk.
Yeah.
Okay, so you cannot just because your baby is sleeping, you also sleep with your baby. Maybe after a few weeks, you might notice the milk is lesser, and on that time you feel, oh my god, what happened? Why suddenly my milk dropped?
Mm. Okay. So if on so to follow on that, would you be able to boost up the milk supply if you've noticed that it's dropped because you've your pumping sessions have lengthened and stuff like that.
Yeah, okay. Maybe this is another topic that we can discuss. Supply, but just to share a quick tips. Okay, whenever you feel that your supply is dropping with whichever reason,
Mm.
okay, first thing that you need to find out is why your supply drop, because our supply won't just magically drop.
Mm.
There's always a reason behind that. If you think that the baby doesn't latch well, This is especially for a new mother. Check back the latching and the attachment. Okay. Number two, if you think that it's because of your pumping schedule, okay, you check back your pumping schedule and go back on track. If you
Mm.
think that you drink less, drink more. If you think you have a very strict diet and then suddenly your milk drop, make sure that you eat enough. Okay,
Mm.
so the key point to increase your supply is to find out first why your supply drop, because our supply won't suddenly drop. Okay, or
Mm.
if you check everything, everything is good, your pump is good, you take care of your schedule of your pumping when you are working, the attachment is good. The last thing that you need to do is check your pregnancy test. You might pregnant.
You're serious?
Yeah, but after you check everything lah, after you check everything, you don't miss your pump, you eat enough, you drink good, you attach your babies well, you check your pump, everything is good. The last thing that you need to do is you check your UPT test. You might pregnant.
Take note, mothers. Okay. The, oh, my baby is 4 months old now. She's drinking about 90 ml, sometimes lesser, for every 3 4 hours. Is it too little for the baby?
All right. Okay. So first thing, Madam Amanda. So how was your baby's weight gain? Is it according to the graph? If everything is fine, how many times that your baby's pee and poo every day? So you need to look on all this, because basically, breastfeeding baby, they are already trained not to drink a lot. They are trained to drink small amount but frequent, because their tummy is not stretching so big during their baby's time.
Mm.
Okay, so if so there's no fixed amount for 4 month old baby, 6 month old baby, how much they need to drink. Okay, it depends on your baby. If your baby looks settled after the feeding, means that he can play, he can just sleep after the feeding. The skin is moist, it's not look dry. The baby pee very well. The weight gain is good according to the chart. So nothing to worry about the amount that the baby drink actually. Okay, Madam
Mm.
Amanda. So don't, because some mother they thought that actually 90 ml is quite a lot. It's 3 ounce. 3 ounce. Okay, because sometimes mother, there's a lot of um Facebook group. There's a lot of people are sharing about their pumping,
Yeah.
yes, amount of the pumping milk. So mother tend to feel so stressed by
Yeah.
looking at that. Okay, so trust your body. Your body will produce according to what your baby needs.
Mm. Okay. I have to control our diet while breastfeeding to lose weight. Ah.
Okay, so you just eat a balanced diet. In Malaysia, okay, our most of our dietitian will just advise mother to just eat according to the meal. You take your breakfast, you take your lunch, you take your dinner according to the suku separuh. You can just find out more about suku separuh. Actually, is 1/3 carbohydrate, 1/3 protein, and half veggie and fruits. Okay, if you really follow that, okay, you can really lose weight when while you are breastfeeding your baby, and whenever you feel hungry or you feel thirsty, because breastfeeding mother is hungry mother, right? We always feel hungry. We always feel thirsty. So you need to just look for a healthy snack. Okay, when you feel thirsty, don't drink Ribena, uh, don't drink Starbucks. Okay, just go for a healthier drink. When you craving for something, you can just eat fruits, eat nuts. Okay, that can give you energy as well. Okay,
So,
I'm not a good person actually to talk about how to lose weight while breastfeeding. I do have, okay? Because I always give an excuse to my husband, because my friends always ask me to go and eat with them. So I cannot, I can't stand that. So I need to eat. But during my confinement, okay, during the maternity leave, I just gained 8 kilo during my pregnancy.
that's
Yeah,
very
because
little.
I already overweight. So don't be so surprised about that. It's normal for me. But I lost 16 kilo.
Wow.
Yeah, so my husband told me, "Oh, you look slimmer compare when before you get pregnant." So actually, breastfeeding do help us to lose weight. Because during confinement we don't eat all the oily foods. Okay, we eat healthy. We eat more vegetable, and some more. My husband is the one who cook for me, so he
Wow.
really make sure that I eat a healthy food. So I really lose a lot of weight. Okay,
Wow.
I'm wearing uniform and I'm working, so all the uniform look loose on me when I go back on the first day after confinement. And it's just take maybe few months to gain back. Okay, because I have Dome, I have Starbucks in the hospital that I work. They are the ones who same actually.
Okay. So the next
Okay.
one is pregnant mothers need to stop breastfeeding. Good.
Yes. Okay,
It's
it's
a good
very
one.
common. Even my mother itself. Okay, my mother itself. Okay, when while she's still breastfeeding my sister, my younger sister, and she get pregnant again. This is the advice that she gets from her friends. So during my teenagers, okay, my mother did tell me the same thing. Okay, when you are pregnant, you cannot breastfeed. Okay, so I believe on that until I become a nurse and I become a lactation educator. Only then I know the fact. Okay, so it's still safe for a mother to continue breastfeed their baby, but there's some criteria that a pregnant mother need to be aware if they want to continue the breastfeeding without harming the baby and their self. Okay, number one, if the mother who are pregnant they want to continue breastfeeding their baby, they need to make sure they do not have any bad obstetric history. Bad obstetric history means that she never experienced abortion
Bleeding.
before. She don't have any abortion before. She don't have any premature contraction from the previous pregnancy. She don't have any bleeding. She don't have any premature delivery. Okay, so you
Mhm.
might talk to your doctor and ask their advice. Either you can still continue breastfeed your baby. Okay, and most of the time, mother who are pregnant, okay, their baby is the one who will self wean off. Okay, sometimes because during the pregnancy, our milk will become a bit salty.
Oh.
Yeah, because of the changes of the hormone. Okay, that's the reason why. Okay, when the baby sucking on the breast, they don't taste the milk nice, and they will just self wean off. But some baby they are very naughty because they're enjoying the session. They will just continue feed on the breast. Okay, as long you don't feel the premature contraction, it
Yeah.
doesn't make you. Okay, you can still continue. But the only thing is maybe a pregnant mother will feel a little bit tired because of the pregnancy and the breastfeeding. So you need to talk to your husband, to your doctor, either you want to continue or not. If the baby is more than 2 years, okay, some baby is more than 2 years, it's fine not to continue and just let the baby focus on the food. If the baby is less than 6 months and you get pregnant again, okay, you might
Wow.
think
Is that possible?
because accident do happen, Shamin.
I only know
Accident
of
do
8 months,
happen.
but 6 months is wow.
Yeah, accident do happen. You need to remember that I work in the hospital, so I know.
Oh, okay.
Okay.
So it is true that if you start to massage and try to express milk out during your pregnancy, it does cause contractions.
Yes. Okay. Some mother might feel a contraction while
Mm,
they are feeding the baby or they express the milk when they are still pregnant,
mm,
but not after 38 weeks.
okay. All right. So okay. So for the next one, breastfeeding will prevent mothers from getting pregnant, so it will reduce the chance of conceiving.
Okay. Did you heard about that before?
Uh, from what you just mentioned about 6 months, no?
Okay. So when you are feeding your baby, okay, sometimes mother thought that okay, I'm a breastfeeding mother, I won't get pregnant because I heard from my friend, she's a breastfeeding and she's not she does not get pregnant because of the breastfeeding. Okay, so actually it's true, but
Mm.
same thing with breastfeeding while you are pregnant. Okay, if you don't want to get pregnant and you are breastfeeding with your baby, that's a 3 criteria that you need to meet. Okay, so remember this. You cannot just simply read the title, oh, breastfeeding will prevent you to get pregnant, and you share with everyone without read the content. All right, so there's a 3 criteria that you need to meet up to make sure that you are not pregnant while you are breastfeeding. But even with these 3 criteria, there are still 2% of mother who meet all the criteria but they still get pregnant. Okay, so you need to really careful. Okay, so what is the criteria? Number one, you are exclusively breastfeed your baby. Exclusively breastfeed your baby means that your baby only drink your milk, no water given to the baby, no formula milk. Your baby is drinking day and night, only with your milk. Okay? Criteria number two, your baby is 6 months old and below. So if your baby is already more than 6 months, you cannot take breastfeeding as your family planning. Okay? So number three, you don't have your menses yet. Okay, so with these 3 conditions, number one, exclusively breastfeeding. Number two, 6 months and below. Number three, you have your menses, you won't get pregnant. Okay,
Mm.
but anytime before 6 months, you get pregnant, like you get menses. So you cannot shock sendiri, oh, I'm breastfeeding mother and my baby is only 4 months, or it's safe. No. You follow all the 3 criteria. Okay, to make sure that you won't get pregnant. But remember, there's a still 2% percentage of mother will get pregnant while breastfeeding, but only 2%.
Okay.
Okay?
Okay. Okay. Interesting. So, okay, but to add on to that, so that means when you start having your menses, does your supply go down?
All right. Okay, actually, uh, if you still, uh, it will affect, but a little bit. It's not really affected uh, in in a way that whenever you have your menses, your supply will suddenly drop. As long as you still keep taking care of your pumping time, your feeding time with your baby, it might a little bit affect your production because of the hormone. Okay, when you are having your menses, you have
Mm.
your progesterone and estrogen in your body, and this estrogen and progesterone, they are not work well with oxytocin and prolactin, and that's the reason sometimes mother when they are having menses, then they can see a little bit, okay, their milk will a little bit reduced, but it doesn't really affect it so much. Okay, and to tell you the truth, okay, I'm a breastfeeding mother, exclusively breastfeed my 2 girls before, and I have my menses when my girl is 1.5 month or less than 2 months. So since
Wow.
that, I have my menses every month.
Wow.
Yes, but I able to fully breastfeed them for 2 years.
Mm-hmm. Wow.
Mm,
That's,
yeah,
that's wow.
okay. So I'm the type of mother who don't really have a full fridge of milk, but I do have enough for them. Okay,
Yeah.
because my aim is to feed the baby, not the fridge. This is
Mhm.
what I keep telling myself whenever I look on the fridge. I don't really have a lot of supply.
Yeah. Every time I open the
Yes.
fridge, I'm like, oh my goodness.
Yeah, so don't feel bad, don't feel sad. If you look at your friend, they are sharing the full fridge of milk, but you only have extra less than 10 pack of milk.
Mm.
As long as you express your milk out and the supply is enough for your baby, actually the crucial time is always the first 6 months when the baby only drink milk. Okay, after 6 months, when the baby start eating, okay, you need to focus more on the food, not the milk already. So it's a little bit uh better and a little bit good for us who don't really have a lot of milk actually, because when the baby start eating, this is the time you can just not to think so much on the supply already.
Mm. Okay, so there's one more. When using a breast pump, does
Mhm.
stronger suction strength equals more milk?
Yeah, this is another common myth. that mother thought, or sometimes they just think about that because they think it in logically, higher suction, more milk. But actually, the answer is no, right? Because a stronger suction, what will happen? Okay, you will even hurt and injure your nipple. Okay, so that's the reason why it's very important. So like Medela is very good. They let the mother try the pump before the mother buy the pump, because I always advise mother before they get a pump, just try the pump on your breast itself to know what suction is good on you. Okay, even you don't able to try this pump before you buy any pump, what you can do, you always start with the low suction.
Mm.
You always start with the massage mode first. Okay, start with the low suction and slowly increase the suction, and you just find the suction that you feel. Need to find a comfortable suction on the breast. Actually, the more comfortable you feel with the suction, okay, the more milk that you will express out from your breast. It's not the higher suction, more milk will come out. You might end up injured the nipple actually. It's not
Mm.
like you get more milk.
Mm. Okay. All right. I think we have a few questions from the audience.
Mhm.
Let's see. Just I saw one here. Is it normal a fully breastfed baby poo poo once 3 to 4 days?
Okay, so Madam Nusuhaida, maybe you can just tell me how old is your baby. Okay, for a newborn baby, they will poo a lot. Can you still remember your baby poo for the on the early days of her life, Shamin? Yeah,
Yes.
they are poo machine. That poo a lot. Sometimes they will just poo with a fart.
Mm.
All right. Okay, so uh, if the baby is 3 weeks old and above, 3 to 6 weeks old baby, and they are only drink breast milk, it's very common they doesn't poo every day. Okay, but you need to make sure that the baby still pee like usual, means
Mm.
that the pee is still wet, the diapers is still wet whenever she pee. The tummy is not hard, it's not bloated, the baby doesn't have a projectile vomiting, the baby doesn't cry without no reason, means that after feeding the baby can sleep well, play well, so nothing much to worry if the baby doesn't poo, and the baby is still fat, so it's fine.
Oh, yeah, from City. Assalamualaikum. Hello, I'm a mother of 5 children. Now my
Wow,
baby
okay.
1 year, 1 month fully breastfed. My problem is my baby doesn't want to use a bottle. How can I solve this problem? I already changed the bottle, but she refused. Any suggestion? Ah.
All right. Okay, so I just share my own experience. My first girl, okay, she not she don't really like bottle so much. After 6 months, she did do drink from a bottle, but after 8 months, okay, she drink from a sippy cup and a straw. So your
Mm,
baby quantity is already 1 year, 1 month. So you are very good mother, still fully breastfeed your baby. So 1 year, 1 month old is doesn't mean that you need to still feed your baby using a bottle. Your baby can even drink from a cup, from a sippy
mm,
cup, from a straw. Okay, it's not necessary because sometimes we just think that okay, a baby they need to drink from a bottle, which is not necessary actually. You can just always transit from the breast to the cup, or from the breast to the sippy cup, or from the breast to a bottle with straw. Okay, so you are
mm.
doing a good job, One City. Irene Mira.
1 year, wow,
I
one
wish
year.
that I have 5 kids as well.
Okay. I have okay. There's one question by Noor Shahida. What is the food recommended to increase breast milk supply?
Yeah. So the food that can increase milk actually. Okay. First thing before we talk about milk, about food, you need to make sure that you already check the latching, everything that I mentioned just now. Okay. But if you look for food, you can find a galactagogue. Okay, you can just Google letter what is a galactagogue. Galactagogue is a food that can increase milk supply. Okay, so what is galactagogue? So, okay, I will just share some of the food that under this category, which are oats, dates, fenugreek, okay, goat thistle, okay, all this you can just find out more. And actually, our galactagogues or our food that can increase milk is also very individual. Okay, Shimi, I
Mm,
did mention before, right? My milk booster, my food that can increase my milk is durian, especially musang king.
Wow, they're expensive.
Yes, but I'm very lucky because my husband is from Bentong, so I can find for a cheaper version
Wow.
of Busangin. So it's depend actually. Okay, it's depend. Okay, so mother can try to drink to eat oats, to drink more, to drink milk, and find what food can increase their supply. It's just try and error, but it's not necessary if that because it's very individual. You need to keep trying. Okay, so Shamin, what food can increase your supply?
I haven't found it. I I've been trying all kinds. It doesn't seem to. Some lactation cookies, yes, I guess.
Yeah.
But food wise, like they say papaya, fish soup.
Yes. All right.
Tak
So
pakai.
like me, cheesecake also will boost my milk because sometimes because when you feel happy on what
Mm,
you eat, it also
mm,
can boost your milk.
true,
Yeah.
true,
So maybe
true.
maybe you can just try and error. Keep trying. Don't give up. It's not necessary your friends are taking red dates and suddenly she have more milk and you drink a red date. There's nothing much changes and you feel bad. So no, you just keep trying.
Mm.
Okay.
So, what about one? I think one last question.
Mhm.
What do you do when you have a bruised nipple?
Sorry.
What do you do when you have a bruised nipple?
Bruise nipple.
Mm, like
All
this.
right.
Yeah.
Okay. First thing, what you need to do, okay, cracked nipple do happen if the position and attachment and the technique of the breastfeeding is wrong. Okay, so you need to make sure whenever you feed the baby, okay, bruised nipple won't happen without reason. Okay, it's always happen because the baby only drink at the tip of the nipple. Okay, you need to make sure that you have a deep attachment to prevent you from making the bruised nipple worsen. Means that you crack the nipple. Okay.
Okay. Oh, fancy baby. Okay.
All right.
So,
So
any more questions for Alpany from the audience?
at least today we already discussed 10 myths on breastfeeding.
Mm-hmm.
All right. Which is if a mother having fever, cold, flu, is it they can still continue breastfeeding? So the answer is yes. Okay. So and number two, size doesn't matter. Okay, it's no, the size doesn't matter. Is no matter how big or how small your breast, you can still produce enough, but you just need to understand about the demand and supply. And number three, it's not necessary for you to drink milk so that you can make more milk. You
Mm.
just need to make sure that you eat healthy, okay, and you have enough liquids so that you will have enough milk for your baby. Okay, and number four, okay, so no big no to the water to the baby, especially for the first 6 months of the baby's age. So always remember this: 88%, more than 80% of breast milk is water. Okay, so what you can do if all people in the house keep forcing you to give water to the baby. Okay, I just share one of the information that shared to me by one of the confinement lady. She's a very breastfeeding pro. So she's telling me that to tell young people cannot feed water to the baby is very easy. But to tell all people in the house that baby doesn't need water is very difficult. So what she will do, she will ask the mother to express some of the milk. Okay, and just let the milk stay in the fridge for a while. Okay, and our milk will divide into two layer, right? So what we have, what she will do, she will bring the milk to the people in the family and explain. Okay, this is water, this is fat. So you see how much water in the breast milk, and they might understand better why baby doesn't need water.
Yeah, that's a good one.
Yes. Okay. So number five. Okay. You are not supposed to clean your nipple with a special soap or need to clean your breast every time before you feed the baby. It's not necessary because your breast will produce their own cleanser, the
Mm.
Montgomery gland. It will produce the oil that can cleanse the nipple naturally. And by cleaning your breast with extra soap and water, it will just make your nipple dry and it will cause sensitive nipple and will end up with a sore nipple later actually. So no need to extra clean your breast. Unless you are really sweating, you can just wipe with a clean water. Okay, and you can just take a bath 2 times a day to make sure that you are clean to feed your baby. Okay, so number 6, mother who are quit nursing with whatever reason, still possible for them to go back to the breastfeeding with a lactation process. Okay, you just need to look for a lactation counselor, lactation consultant, or a doctor who understand breastfeeding that and they can help you with this process. Okay, so number 7, so don't worry about feeding the baby whenever the baby cry or carrying the baby because your baby will not get spoiled. But actually, you are meeting your baby emotional need, which is very good for their later development. Okay, so number 8, you need to make sure that you are feeding your baby on demand, especially for your a newborn baby. If the baby is sleeping more than 3 to 4 hours, you need to wake up the baby to just let them feed on the breast. Rather, you just let the baby to continue sleep because it will end up if you are not feeding the babies on demand, baby will drink less. Okay, the risk of baby to get jaundice is lesser because the baby will pee and poo less. Okay, so you need to really make sure for a newborn baby, especially for the first 1 week, you need to feed them at least 8 to 12 times in 24 hours. Okay, so number 9, pregnant mother need to stop breastfeeding. So it depends on mother history. If they have a bad obstetric history that we discussed before, they need to share and discuss with their doctor, or else you can safely continue breastfeed the baby. Okay. Number 10. Okay, breastfeeding do prevent mother from get pregnant, but with the 3 criteria. What is the criteria, Shamin?
No menses.
Yes.
Uh, Fully breastfeeding.
Yes, good. And the last one,
The last one was what, ah?
exclusive breastfeeding. Exclusive breastfeeding. Okay, exclusive breastfeeding, 6 months and below, and no menses. Okay, you
Six
won't get
months and
pregnant.
below.
So the 11, okay, stronger suction doesn't mean more milk. Okay, remember, the more comfortable you with the suction, the more milk that you can express from the breast.
Mm. Okay. All right. Thank you so much, Alpani. So I think you're gonna have you're having a very busy day right now, right? So you need to rush back to
Yeah,
work.
I need to change this few times. Someone are using the room. Yeah, really sorry on that. But I hope that I still give good information to mother out there to enlighten all their worries, all their curiosity on all the myths that they commonly hear out there.
Mm,
Okay?
yes, definitely. Thank you so much, Alpani, for your time. Yes, and like just thank you for even clarifying personally my questions and my myths. All right, so we'll wrap up with Alpani. So thank you so
All
much,
right.
Alpani.
Okay. All right. So thank you so much, Medela, for inviting me. But I just want to disclaimer, I do not represent Medela. Okay, I just share all the benefit of breastfeeding to mother out there. I'm not promoting teats or bottle, but I just share
Mm,
all the good knowledge on mother out there. I'm very happy Medela are inviting a counselor and lactation educator to share correct fact with all mother out there to make sure that they can breastfeed their babies well, to make
mm,
sure that they don't get all the false information
yep,
from just mother experience. Okay, to make sure that they are enlightened with all the fact on breastfeeding. So
yep.
thank you so much, and I'm so happy that I can share with all mother out there. If you do have any problem, okay, even this is not your first baby, this is your second, third, fourth, okay, so don't worry, there's a lot of counselor out there that will help you. You just need to find out. Okay, if you do have problem, don't just sit in your room and keep thinking yourself how to solve the problem. Sometimes you just need to speak out. Okay, there's a lot of lactation counselor, lactation consultant out there that can help you with your journey. Okay, breastfeeding. I love this quote so much. Okay, to breastfeed a baby, it's need the whole village to help the mother. It's need the whole community to help the mother. It's not only the mother's responsible. It's not only the mother's work to feed their baby. Everyone in the community is responsible to make sure every baby gets their golden milk.
Wow, nice. Thank you for those last words to end it. All right, thank you, Anthony.
All
Well,
right.
we hope to see you back here again.
Okay, thank you so much.
Yes.
Bye.
Bye everyone. Okay, so stay tuned. We're gonna announce the three lucky winners for the like and share. So they are Barney Ting, Nur Suhaida Suhut, and Yuzana Yassin. So congratulations to the three of you. Do get in touch with us on our Facebook Messenger on Medela Malaysia or Medela Singapore, and we'll contact you about how to collect your prize, which is this, if you've forgotten. Yep. So congratulations to the three of you, and thank you to all of our viewers for watching. We will be back soon on Saturday, next Saturday, with Dr. Karen Fung. And do like and share and tell your friends to tune in then, and follow us on Instagram and Facebook to get more updates. And you can also view the, the, the videos on our Facebook pages. So do like and share and follow us. So thank you everyone. Have a good rest of the day, and hope all your questions and myths have been answered. See you all then. Bye.